could I invite, please, our panelists, Themistocleous, Ansgar Hebborn, and Nikos Maniadakis, please. Thank you. Hello. Good morning. Hello. Nice to see you. Welcome. So this is in some ways a continuation of the conversation about innovation and innovation in care. We're looking very much at what to expect in the future, and also, as we were hearing right at the end, Greece. How is Greece positioned to embrace the new era of innovation? So, Themistocleous, Deputy Minister of Health for Greece, could you give us your view on this starting view? Will you speak in Greek or English?
English.
Perfect.
So it's always fascinating to listen to Mr. Boulard, and I will start using a word that he used in his speech, that what is coming in the future, and he said renaissance in discoveries. So we have all to agree that innovation can bring longer, better lives, and we can achieve better lives for our citizens, for our patients, but innovation is a key driver of health expenditure. And if we see the data from the last years, and in Greece and in other countries, more than 50% of the annual increase more than 50% of the increase in the annual cost is due to the innovation. So we have to find the ways, the processes. This is, I think, the key driver, that we will make sure that all our patients will have the medicines that they need, but we have to secure the fiscal stability of the system. And these have to take account also values, social values and preference in every place. The way to deal with that is with health technology assessment, and this with one of the biggest efforts we are doing today in Greece. So what's the situation currently in Greece is that every and any patient in Greece has access to medicine, and the medicine that need. This is not negotiable. We have different channels. We have either the normal reimbursement procedure, or we have other processes like IFET or SIP. People from the industry could understand this. And we are now in the process of reforming and restructuring all the policy regarding drugs. We are now in the reforming and actually the better way is restructuring our HTA process in order to align them with the European regulations, with the new European regulations. And we have support from TSI, DG Reform, with collaboration with WHO and local and international experts, actually to transform it from just a negotiation body that is now to the new era of assess technology according with the results and all that. So we will create in the next steps to create an innovation fund that will secure the access of all our patients to the novel technology, to the new technology, to further expand the entry agreements with AOB and all that, and in order to make sure that we have incentives for the industries. It will decrease the uncertainty for us, for the one that is paying for the drugs, but also to access the efficient way where we spend our money. So we are going to spend according to the result. We are not there right now, but this is something that we have to achieve in the next year. We are using Horizon Scan. We have to expand this in order to have a clear view what is coming, and in the clinical setting, and in the budget setting. And now, and I think that it's one of the first time that this is saying in the public, we agree in the reimbursement of biomarkers in order to align with the new era of personalized healthcare, biomarkers for cancer care, and we create the process that biomarkers are going to assess in order to enter the health market. So we are trying to reform, to transform, and I think the biggest question in the room is, do you have the money for that? The money that I would say that this is the first time our administration, the first time that it increased the budget for drugs. We have, generally speaking, an increase in whole health. In my portfolio, hospitals, the budget of hospital has almost $500 million more than last year. And in drugs, we have 300 million. There was a ministerial decision signed in May that allocates the 300 millions for the drugs, 80 millions for the retail, 100 for the high-cost drugs, and 120 for hospitals. And we are reforming our procedure, ECAB. ECAB is our procurement organization, which actually is a new organization. ECAB was established 10 years ago, due the years of but now it's in the process that it's a big organization. We have a new platform. The system is all digitalized, and we will be able, first of all, to give transparent to the industry and to be able to calculate the clawback real time, and this to reduce the arrears and make more sustainable the system. So there are more steps to be done, but I think that we are moving in the right direction, and in order to secure that innovation, Mr. Boulat said what is coming. We have novel technology in cancer, in all other diseases, and that we have to make sure that our patient, our citizen, will have access as quickly as possible to this innovation.
So thank you, and I think you've highlighted the critical issue, which is money. But it seems to me that there's the immediate question of the money to cover the treatments and the medications that are there now. But then we just heard, this extraordinary, if it is indeed a new era of innovation, and we're going to have many, many more drugs coming onto the market, the demand is just going to grow. So how do you begin to plan for presumably the explosion of need that this is going to generate as people are desperate to get access to treatments that will suddenly be available that weren't available before?
We have to assess all these new drugs, and we have to pay the drugs according to their results.
Yes.
This is the only way we can deal with that. That's why we have to improve the capacity of the health technology assessment in order to assess all this, and of course we will need more budget.
Yes. Well, I mean, it's an issue that all health systems grapple with. Greece is far from unique, of course, in this. Could I turn to you, Ansgar Hebborn, Head of Access Policy Affairs for Europe for Roche, another very big, very important pharmaceutical company. What is your perspective?
Thank you, Daniel. Thanks for the invitation. Before I start, I think we share this vision. I think we share the vision that you have laid out here, and I think we want to be part of working us towards implementing this vision, which is challenging. It's a vision that I think we see in quite a number of countries. The challenges are similar, quite nuanced in certain areas in Greece. No doubt, we do live in turbulent times. I think you mentioned, and we heard about the geopolitical trends that deserve innovative answers. I think the answers of yesterday will not really address what we have in front of us. At the same time, there are exciting technological opportunities. We heard about AI specifically. They not only help us as private sector or the public sector to innovate, but I think they also carry enormous opportunities for patients, for how patients engage with the healthcare system, but also for empowering patients to approach the healthcare system with a certain demand for technological and other solutions for their challenges. Let me highlight three areas, and we heard a little bit from Albert Bohler about those. You look at the pipeline, for example, the pipeline of my company, you have a wide range of innovative medicines, but also other technologies that really need to work together to deliver the envisaged outcomes. Think of patients with rare diseases. I Think of cell and gene therapy, which really offer opportunities potentially of curative outcomes here. Think of cancer medicines. Think of precision oncology in this space. I think we've achieved a lot in the past and will, based on a strong foundation, also a strong technological foundation, achieve more. I think then there are certainly there is this link to specific capabilities within the healthcare system. Without those, it's impossible to deliver the outcomes. So it can deliver on its own. I think you mentioned the access to molecular testing or to new testing opportunities. Genomic sequencing is an important foundational element of delivering these therapies. And then, of course, when you look at the geography of Greece, I think what comes to mind is the burden and cost to seek and get access to care. So this geography, I think, seems to be an important platform for tools and innovation like telehealth, telemedicine, and a new engagement for patients. I mentioned the need for combined technologies specifically. At the same time, there are fundamental challenges in the healthcare system, largely driven by an aging population. But these are many more patients on one hand. It's just a much larger number of people, often with more chronic conditions that seek care at the same time. These are patients that grow into, or that are grown up and ultimately have probably also quite different expectations from the healthcare systems. And then I think there is a fundamental challenge here, and that's workforce shortages. It's the shortage of workforce to deliver care that all systems have to prepare for, and it has to do with the same topic, the changing demography. We talk a lot about sustainability. I think it's important. We need to grow healthcare systems in a sustainable manner. Sustainable manner for all participants. I think certainly also for industry and other sectors and other parts that are actively contributors to the healthcare ecosystem. In this sense, I think standing still is clearly not an option. It looks sustainable if you stand still and try to maintain. I think we need to evolve and we need to create these correlated complementary capabilities of the healthcare system to fully embrace technology and innovation. Innovation not only comes in the form of new outcomes, new opportunities, but I think also there has to happen a lot from within the health system in terms of process innovation, how we deliver care. So how do we bring this all together? I think it's just 4 areas probably that I highlight. We may have a chance to go to this more in detail. I think you mentioned the need to address the structurally underfunding of the healthcare system. When you compare Greece with the rest of Europe, I think per capita expenditure is less than half of that of the average in Europe. When you think of the accessibility of drugs, out of the 160 drugs that were newly approved in Europe during the last 4 years, about half are accessible in Greece, which is an average position. But certainly, I think there is an ambition to reach for a higher level. I think we need to address inefficiency in healthcare systems. The OECD considers this a major source to also reallocate and fund innovation. I think we heard a lot about HTA, horizon scanning, the opportunity of a new way to assess in a collaborative manner health technologies to allow an earlier start for the adoption of health technology. I think a specific challenge here for us is the idea to wait for 5 other countries that first have to positively decide before the process can reach a certain stage in Greece. I think that's something that the European Union wants to overcome with the EU HTA regulation. Same starting point, very early for the adoption. And maybe my last point here, I think we need not only our innovation, the innovation of the industry, of companies like Roche or Pfizer. It needs also that we unlock the innovative potential from within the healthcare system. We need the many people, the many individuals in the system to reconfigure how outcomes, how healthcare is delivered. We need their capacity to be part of this. And I think together with the private sector, we can introduce and use reforms that will ultimately help to realize efficiency in care. And I mentioned this, Roche, this innovative industry wants to be part of this surge journey.
Well, thank you very much. I think I take from this, we've heard, of course, the critical question of money, but what you've brought to the table is that it's not just money, it's a whole ecosystem. The innovation has to go throughout the ecosystem. But my question to you is, I mean, it sounds, and of course is, terribly sensible, but it's also terribly hard, right, to get these systems to change. These are quite entrenched systems, not a bad thing that they operate on very established processes, but they're not used to responding with the speed of innovation today. So how do you speed up the innovation in all these related systems? Perhaps you could, if there were one or two things that you think would really help there.
Yes, I think one element is certainly planning ahead. I think we have an understanding, and together we certainly have an understanding of the innovation that's coming. So in this large cloud of innovative opportunities, we need to pick early opportunities. And we are in the European Union. We have these collaborative opportunities, non-legislative health system strengthening initiative. Horizon scanning is this term, which also belongs to this HTA space. I think this is an important element.
Great. Well, Nikos Maniadakis, professor at the University of West Africa, you're going to solve all these problems for us, I hope.
No, regulators will solve all the problems. As it was pointed out by the CEO of Pfizer, it's a highly regulated industry. So whether everything that happens is around, policy, health regulation. And this discussion now has been going on forever, and it will continue forever. It's a moving target. There are two major underlying trends. One is we live longer, and thank God to technology. Every 10 years, we gain 1 year of life expectancy. We have an aging population that will be consuming more and more of healthcare resources. And on the other hand, we have the technology sector. It's not all about pharmaceuticals, medical devices, equipment. Lots of different technologies are coming now to change the landscape, and that's for a good reason. So this is putting a lot of stress on the economics of all countries. Regardless of where you go, there is a major issue how to fund healthcare, how to use these funds efficiently, and how to allocate the funds in a way that will maximize return on investment for the people. And as far as I'm concerned, when it comes to pharmaceuticals, which is the topic of today's debate, there are three major pillars which must be really designed well and regulated well. One is the financing, how you should be financing, what sort of resources you should be directing to healthcare and pharmaceuticals. The second is pricing and reimbursement, what we call access to the people. And the third very important issue is how you use the technology in the healthcare system in a way that is efficient, is maximizing outcome for the investment it takes place. And in that light, I will share with you a couple of thoughts and stress some of the things that Marios said before. First of all, when it comes to financing, Greece is coming out of an era of economic crisis. You've been here before in this event. You've been discussing the financial issue. I think that, as it was pointed out, the healthcare system and the pharmaceuticals are underfinanced. The government needs to think again how they will pool resources to direct them to healthcare and pharmaceuticals. And also there is an imbalance between public and private financing in Greece, so this needs to be corrected because it creates equity issues. And things like, horizon scanning, the government and the healthcare system needs to know, what's coming out there, how they're going to find ways earlier on to finance new innovation, what's going to be the budget for the next few years, and how it's going to be split in between public and private sector. So that's another one area that the government is working and the ministry is working, and it needs to improve further. The other one is pricing and investment. So Greece has an external price referencing system, That's why it's relying a lot on health technology assessment. And as it was pointed out, some of the things that prevail from previous decade, they need to be abolished. For instance, the reference to 5 other countries, once something's reimbursed in 5 other countries, then it actually can be reimbursed here. That needs to be abolished. Since we have an organization now, an HTA, the government has started a huge initiative on HTA. There is a European also initiative which we can rely on it. So some of these delay factors can be taken out of the system. And I must say, as far as health technology assessment is concerned as well, there needs to be a reward for value. Right now, there is no reward for value. There is a technology assessment, but then the manufacturers, they have to start giving extra rebates and discount on top of what is being given already. So basically, this is not really an environment where innovation, better outcomes are being rewarded, and this needs to be reconsidered. And the final thing is how we use technology. Utilization has a great impact on health outcomes as well as on the economics of the system. And as it was pointed out by the previous speaker, we need to be holistic. We need to understand that pharmaceuticals are part of the healthcare delivery equation. There are many areas where we can deliver efficiency by better using of resources and better use of pharmaceuticals. And so basically, we need to use all the data that the system is generating. We need to be innovative in the way we organize healthcare and basically collect the data, and as it was pointed out by the minister, reward outcomes, reward better outcomes by introducing outcome-based agreements, risk-sharing agreements into the system so that we direct the money where we get better outcomes. The government and the minister is working in the last couple of years in that direction, and I'm sure that they will accelerate this effort and they will deliver more value for money and better access to innovation in Greece.
Thank you. Very helpful and lots of good ideas there. Also, I thank you for pointing out that the stresses on the system are happening for fundamentally positive reasons, that people are living longer and the technology is becoming available. So the good news is generating all the problems, as it were. Our time is very short, but I wonder if I could do one round of comment from you on, I suppose, the European dimension of all this, because there's both, and some of your remarks have touched on this, but there should be opportunities of the fact that Greece is part of a European Union, both to learn from other countries and to benefit from all the work that goes on in those countries. And there's a danger that in healthcare systems especially, there is a kind of inward-looking obsession with one's own system, whereas in fact at the European level, there is much to be learned. So if I could ask each of you very briefly to say what lessons you think, or in what ways the European dimension could help Greece. Maybe go in reverse order. Why don't you start and then we...
I have the experience actually of being involved in the design of reforms during the crisis. And every tool we used to improve the efficiency of the healthcare system came from the European experience. So there are, in the organization of hospitals, in the financing, right now, for instance, we introduced a DRG system that we borrow from Germany. So there is so much knowledge, experience, expertise, successful ideas that have implemented around in the European systems. So we can learn and adapt these best practices to our system.
Do you think that Greece is doing enough, and it wouldn't just apply to Greece, are countries around Europe doing enough to do that, to learn from other partners, or is it?
There aren't. There are certain areas where the European Commission is driving developments. For instance, HTA is an area, it's a particular example. But I think there is so much to learn. We're not doing that very well, but there is so much to learn from others and share, learn, and apply best practices from one healthcare system to the other.
Ansgar.
Yeah, I think there is definitely a European sphere. There's opportunities, but too often I think there's focus on legislative initiatives, legislative measures that often use the wrong instruments. The ultimate responsibility for healthcare systems in Europe is within the countries. So it's there, and I think we need to really seek from there this collaborative input and advice. I think we need to ensure that we have exchange at all levels. We need to use, of course, the regulatory opportunities. There is this HTA regulation, which is important, but there are many other programs where it's more about sharing expertise, benchmarking own practices, and to learn and research for new things where we can really collaborate between countries and use best practice. I think it's important. Greece is on the right path, for sure, to seek for these solutions. There's no country best practice. So if you would have asked, it's hard to say. I'm from Germany, which is really struggling with healthcare reform, for sure. So I think using these non-legislative health system strengthening initiatives and to engage at all levels at a European collaborative platform for system advantages, I think is critically important.
Very good.
Yeah, we have to take the good and the best practice in other countries and to adapt them, and we have to be in a collaboration. Mr. Maniadakis said we are now with the contribution of European Commission, the DG reform, trying to restructure our HTA process. But as already said, all countries are struggling in the health system. And Greece is, although is underfunding, we have to say that our patients have access to novel technologies. And we are in some areas, for example, in oncological medicine, we are above the average European in innovation. For example, in the years 2019, 2022, 70% of the new drugs for cancer, they were available to our patient, which this is much better than the average European. But sure, our system needs reform. And we don't have to reinvent the wheel every time. We could see what's going on in other countries. They have HTA that is working long years now, and it's not working as just negotiation with the industry. And we have to adapt this best practice in our country as well.
Very good. Well, I think that's where we have to draw this to a close. But I draw from this 3 E's, in fact. Euros, there's the money question. Ecosystems, there's bringing everything together. But there's also some easy wins, quick wins to be had from some things that could simplify the system, streamline the system. And we've heard some very good ideas about that. So thank you very much, all of you, for a very stimulating and constructive conversation. Thank you.
Thank you.
Thank you.